Mikhail, do you want to, can you hear me, Mikhail?
Yeah, I can hear you.
Can you start hand examination as you told before? So I can
Yeah,
start
just
timer.
let me set up 1 minute.
Okay. Rick, can you please mute your mic?
Okay, can you hear me?
Yeah.
Okay, so you can give me the scenario. I'll try my best to show it like from here because I've kept a still camera.
Okay, no problem. Mm, Basically, the scenario is a patient come to you with diminished sensation in thinner eminence and muscle wasting in thinner eminence. Examine his hand.
Okay.
Going
Um.
to start timer. I'm going to start timer.
Okay.
So 6 minutes for your examination and 3 minutes, rest of the 3 minutes for summarization and cross
Okay.
question. Is that okay?
Yeah. Perfect.
Okay, I'm going to start. Can you see the timer?
Yes. Okay.
Okay, go please.
Okay. So I'll come and wash my hand. Hello, my name is Dr. Mikhail. I'm one of the surgical doctors. May I have your name and age, please?
Hi, my name is Annie and I'm 32 years old.
Hi, Annie. Nice to meet you. So today I've been asked to examine your hand and wrist, which involves looking, feeling, inducing certain movements, and doing some special tests. Will you be comfortable with that?
Yes, please.
Okay. It'll also involve you exposing your hand up to above your elbow.
Yeah.
Will you be okay with that?
Yes.
Do you need a chaperone?
No.
Okay. I want to ask you before we begin, are you having any pain at the moment?
No, not really.
Okay. So in case you have any pain, please do let me know. We will stop the procedure in between. All right.
Okay.
Okay. So let's begin. So can you just show me your hands, your palms straight like this? One. Very good. Can you just rotate your? Can you rotate your hand? Okay. Can you spread your fingers and show me? Okay. I'll also check the elbow region. Okay, to check for psoriatic plaques and rheumatic nodules. Okay. Okay, can you show me your hands? Okay, we'll just start feeling for your hands now. Okay, so turn your hands around, please. Okay, just checking the temperature. Okay, checking the pulse. Checking the pulse. Checking the pulse. The pulse. Okay. All right. Just going to check if. Let me know if you feel any pain. Okay. Okay, checking the ulnar region. While checking, I'm going to check the faces to check for tenderness. Okay, checking the ulnar border. All right. Okay, thank you. All right. So I'm just going to ask you, give you some actions. I just wanted to follow it along with you. Can you make a fist? Okay. Can you open your hands? Play your fingers. Perfect. All right. Just leave your fingers floppy. I'm going to do it myself. Okay. Okay. All right. Can you join your hands for me like this? Okay. Perfect. Can you join the opposite palm? Perfect. Okay. Just leave it floppy. Right. Okay. Can you mimic the movements which I'm showing you, please? Okay. Just turn your hands around. Okay. So in, out, bend, out, in, out, thumbs, perfect, and round. Okay, perfect. Thank you. All right. Can you keep your hands? I'm just gonna move your thumbs. Thank you. All right. Okay. Now I'm just gonna put some pressure. Can you please bend your last knuckle for me? Can you please bend your last knuckle for me? Perfect. Thank you. Just gonna put both your hands on top. Keep both your hands on top. Can you please bend your fingers for me? Bend the middle finger for me. Perfect. Thank you. Okay. All right. Now I want you to hold my two fingers tightly. Resist my pulling. Okay. Now I want you to hold just with your index finger and thumb. Resist my pull. Okay. Thank you. Now I want you to take this object from me, from my hand. Thank you. Give it back to me. Take it with them from my other hand. Perfect. Thank you. I want to keep your hands straight now. All right. So I'm just going to check. Let me know if you feel sensation.
Yes.
Do you feel sensation?
Yes, a bit.
Yes.
Yes.
Yes. Can you turn around? Do you feel sensation?
Yes.
Okay. Do you feel sensation? You turn around. You feel sensation? Feel sensation?
Yes.
Perfect. Thank you. Okay. Now turn your hands around. I want you to, against my force, open up your fingers. Okay, good. I want you to, against my force, open up your thumbs. Open, put pressure. Okay, perfect. Thank you. Okay. Keep your hands straight. I want you to resist me putting your fingers down. Okay. Okay, perfect. All right. Okay. So keep your hands open in front. Just want to do some special tests. Okay. So in case you feel any pins or needle sensation or pain, please do let me know. Okay. You feel anything? You feel anything? Okay. Can you keep your hands inward? Yeah. This for me. Can you hold it for 60 seconds? Do you feel any tingling numbness here in your wrist? Okay, I'll keep it for 60 seconds. Leave it. Lastly, I want to just keep your hands flat down. I want to check the distance if all the fingers are touching equally. Okay, thank you. Okay, thank you so much, Sam. Do you need any help redressing?
No, thank you.
All right. Okay.
If I'm
So
finished,
thank you for
can you please summarize your case?
Yeah. So I examined my patient and I examined her wrists and hands. On inspection, the palms and the wrist appeared normal, bilaterally similar. On palpation, there was no raised temperature. There was no tenderness. Squeeze test was normal, and on performing movements, all fingers moved symmetrically, and the thumb moved symmetrically and freely in all direction, both on passive and active movement. Wrist movement was preserved and normal, and flexor digitorum profundus and superficialis function was preserved, and power pincer grip was preserved, precision grip was preserved, and all neurological examination was within normal limits. So considering my findings, my differential diagnosis for this patient are carpal tunnel syndrome, ulnar palsy, and Dupuytren's contracture.
Okay. So can you please tell me the risk factor for carpal tunnel syndrome?
Diabetes mellitus, history of smoking, history of tobacco intake, COPD, and for the white race patients, Caucasian race patients.
How do you investigate this case?
So I like to begin with hematological examination, which includes full blood count, urea electrolyte, CRP, LFT. I would also like to do diabetic profile, blood glucose levels, HbA1c, and thyroid function tests. And furthermore, I'd like to do certain special tests like electromyography as well as nerve conduction studies. And lastly, I'd like to do some radiological imaging like X-ray of the wrist and MRI of the wrist.
What are the
Management is you'll begin by conservative management, so splinting of the wrist, pain control with NSAIDs, and steroid injections. And in case carpal tunnel presence is suspected, then carpal tunnel syndrome, then you'll go for carpal tunnel release. And if you're suspecting Dupuytren's contracture, then you can go for fasciotomy or percutaneous release of cord with wide bore cannula.
Okay. So what are the non-operative treatment for Dupuytren's contracture?
You can go for steroid injection, splinting, and collagenase.
What are the operative option?
Operative is fasciotomy.
Your time up,
And
but I'm going to ask you a few more questions. So what are the
Yeah.
risk factors for Dupuytren contracture?
I'm sorry.
What are the risk factors for Dupuytren contracture?
Diabetes mellitus, COPD, tuberculosis, Caucasian patients, tobacco and alcohol intake.
Okay, thank you so much for your participation.
Yeah, thank you.
I'm going to explain this station now. So you did quite good for this station, but remember something, like when your inspection is good, you check all front, back for looking, and when you are checking your filling portion, so you should check thinner hypothinner eminence. So this is the important point for, I mean, you have to palpate that thinner and hypothinner eminence, as this case
Okay.
is a tunnel syndrome. That's why thinner eminence, hypothinner eminence is important. Second point is, did you check the anatomical snap box tenderness? Discovered fracture.
No, I forgot the anatomical snap box.
Okay, so you have to check while you are going to palpate hand, so you should also anatomical snap box along with all joint tenderness, metacarpal squeezing, as well as checking pulse, so that you should start with temperature tenderness, but at least just remember this point so that you can't forget this. So, and you check all movement, active and passive movement. Just can you show me the sensation again? Did you check the radial nerve sensation? Can you hear me? I can't hear you.
Sorry. Yeah, I did check the radial nerve. That's the first web space.
Okay. So when you are going for differential diagnosis, remember everything related to hand is also related to cervical disc. So differential diagnosis should be carpal tunnel syndrome as well as cervical or disc prolapse and diabetic neuropathy. These are the main differential for this case. Okay, so while you are going to do risk factor, the key point they want that is diabetes mellitus and thyroid disorder, rheumatoid arthritis. Don't forget this point, and it should be related, like diabetes related investigation, thyroid function test, as well as rheumatoid arthritis related test. So you should mention in blood investigation. And you did mention all investigation related to imaging, like MRI, X-ray, and the electrophysiological stuff. And treatment, okay, that's fine. You mentioned that treatment point, as well as you mentioned other things for Dupuytren contracture. That's quite good. I mean, you did quite good for this station, at least more than 80% in performance. But just remember the small points so that you can improve yourself and you can get more marks. You can achieve more marks for this station. And order should be chronological so that you can finish within 9 minutes. I mean, 6 minutes for performance. So you should finish within 6 minutes. That's why practice is really important. That's why repetition is really important, so that you can't forget the chronology. And always remember, this is the orthopedic examination. So while you are describing this, don't go for inspection, palpation, percussion, auscultation. Just go for look, feel, move, on my look, on my feeling, on my during movement. So you should describe like this during orthopedic examination. But if it is abdominal examination or the thoracoabdominal examination, then you can mention that inspection, patient, percussion, auscultation. That should be the chronological order. Do you understand my point?
Yes, thank you.
Do you have any other question regarding this?
No, thank you so much.